Every time I see a group of people gathered, I rarely ask what they're doing. I hope in this video, you can get a bigger picture of what OTs do.
Hey, this is David from OT Focus, and today I'm going to talk to you a little bit about OT specialties. I'm going to talk about a few common specialties and a few less common. Your number one specialty you're going to see most OTs getting into is actually pediatric OT. So pediatric OTs are primarily working with the pediatric population, and they're just helping them with motor function, helping them with neurodevelopment, handwriting, or fine motor coordination activities. There's a number of activities that they may be doing to strengthen their hands and their coordination. Pediatric OTs will actually work with all different types of kids. So they may work with a kid with cerebral palsy or Down syndrome, or just a kid that's struggling with handwriting. The second most popular specialty in occupational therapy is going to be acute rehab. So most OTs, when they graduate from OT school, they get into pediatric OT, or they're going to work in acute rehab or a skilled nursing facility. So this group of students is mostly working with the geriatric population, helping them get out of bed, helping them do their daily activities so they can be safe to go home. This might include helping with a patient who had a stroke recover, or just help someone that had a knee surgery or hip surgery, or someone who went through a major trauma or motor vehicle accident, to help them through the rehab process so they can return home. There's also acute care OTs that work in a hospital setting. They may work in the ICU, ortho units. Typically they're going to work throughout the whole hospital and cover all the floors. So they're going to work in the ICU, ortho, they're going to work in med surg, and they're going to be seeing pretty much all the patients that need some sort of rehab, so they can either go to a rehab facility or go home. Another less popular group of OTs will work in mental health. Mental health can vary depending on where you work. There's OTs that work with prisoners that are in a mental institution, or they may just work at a state institution helping people that have schizophrenia or bipolar or other disorders related to mental health. So OTs in mental health may help a patient with like a skilled activity. This could be like a game, it could be an exercise, it could just be like doing meal preparation, just to help the patient find something meaningful and help them become more independent through these meaningful activities. Now there's other OTs that are going to work in neuro, specifically seeing like more stroke patients. There's going to be OTs who are just seeing mainly spinal cord patients. There's OTs that work in outpatient settings that might be helping patients with upper body strengthening or neurodevelopment. You can actually be a hand therapist, and to be a hand therapist you can be an OT or a PT, and you're mainly just working with a population that had surgery or had a significant hand injury, and you're helping them with strengthening and range of motion and making sure that they can just do all those normal activities that you do with your hands. Okay, so let's talk about some less common OT specialties. I'm gonna say lymphedema is probably a specialty that you don't see with OT as much, but OTs work in lymphedema. They're just kind of helping patients control the edema, helping them with taking care of the patient's skin. They may do wrapping, they may teach the patient some retrograde massage techniques to help reduce the edema. And OTs may actually make recommendations to help these patients get fit for different compression stockings. Okay, next up is driver rehab. This can be a wide range of patients. You might have like a younger patient that had a spinal cord injury that wants to be able to drive again. Or you may have a patient that had a stroke who's older that wants to get back on the road. Driver rehab specialists are typically testing people's vision, their cognition, and seeing if they have the physical ability to be able to drive. So to see if they can turn their head, or if they can reach the steering column or everything in their car, and then just seeing if they're cognitively fit enough to be able to make those decisions while they're driving. A driver rehab specialist will typically test and evaluate a patient, and then they usually will write a letter of recommendation to the doctor. As a driver rehab specialist, you can't really tell a patient like you're safe to get back on the road again. You're just telling the patient, here's a letter, and I can say if you're safe or not safe to drive, and you can give that to your physician. And then once the physician approves that, the patient can drive again. So that's how driver rehab works. Okay, another specialty for OT is going to be low vision specialists. I don't know a lot about low vision. A lot of them work in outpatient clinics. So if you have low vision problems or diabetes or neuropathy or some other problem with vision, you can see a low vision specialist and they can kind of give you tips and tricks and actually make some recommendations so you can get around the home safely. A low vision specialist is just focusing mainly on how can I help a patient become more independent with their daily routine by helping them improve their vision. Another field of OT might be ergonomics. I'm actually an ergonomic specialist. I have a whole page about it. I'll put in the link in the description. Most ergonomic specialists are actually working in an office setting. So you're helping a client or a patient or an organization reduce their workplace injuries. Now, if a patient has carpal tunnel or something like that, you can actually arrange their desk, their keyboard, so their wrists and fingers and everything's kind of like in a neutral position. As an ergonomic specialist, you may also assess a person's vision to make sure their monitor's in the right place, ways to avoid glare. You'll look for ways to just make sure someone's not injuring themselves at work. And I think this is kind of like a growing field right now because there's so many people who are working from home right now and they're not sitting in like a good chair or an ergonomic position. Okay, there are OTs that are actually working in hospice care to just kind of help patients with end-of-life care. So they may do like music therapy, or they could help organize like a scrapbook or something for a patient, or just go through journals or memories just to kind of help put a patient at ease and help them feel that their life was meaningful. And OTs in hospice can also help the families. Now, another more common OT specialty will be home health. This is where OTs actually go to a patient's home and make sure that they're safe. So they may actually, like, if the patient's like at a risk for falling, they may remove the rugs in the home. They're gonna assess if the patient can get in and out of bed, get in and out of the shower, make sure the patient's able to get to the kitchen if they wanna prepare a meal or something. OTs in a home are just mainly helping to see if a patient can do their normal daily activities. Now, there's also OTs that work in assistive technology. This could be like home modification, where you're going in a person's home, you're installing grab bars, you're installing seats in the shower or a bench. You might install like a lift for the stairs so a patient can get up the stairs without having to walk up them. OTs may also work in assistive technology to help a patient use augmented devices. If they're unable to speak, they can push a button on an iPad or something like that to tell their caregiver that they're hungry, or they want to get dressed, or they want to take a shower. So I can't list out everything you can do in OT, but I'm just going to leave a list here of things you might consider, and just a broad range of certification and specialties for OT. All right, I hope you liked that video, and please like and subscribe, and check out my website, otfocus.com, so you can get my newsletter and check out what's going on and what's new in OT.